Bismillahirrahmanirrahim. Today we will have case quiz number 119. Case data: 16 years old, previously healthy girl, complaining of 1 year history of bluish discoloration of fingers and joint pain, accompanied with recurrent transient episodes of knee and elbow arthritis. No additional constitutional or systemic symptoms. No family history of a diagnosed rheumatological disorder. Examination showed temperature within normal 36.5, heart rate 86 per minute, respiratory rate 16 per minute, blood pressure 110/65 millimeter mercury. There is hepatosplenomegaly detected by clinical examination, but no other abnormalities were observed. Investigations showed white blood cells count within normal 3,000. Around 70% of them are neutrophils and 23 are lymphocytes. Hemoglobin show mild anemia 10.9 gram per deciliter. Platelet count within normal 235. Biochemical parameters show urine analysis and coagulation tests were within normal. C-reactive protein was 11 and the normal is below 5, so mild elevated. ESR elevated 52 mm for the first hour. ANA was positive with a titer of 1/1280, so a very high titer of ANA by immunofluorescence. Anti-double-stranded DNA antibody was positive and anti-Smith was positive. Anti-SSA and SSB, anti-Rho and anti-La, and anti-phospholipid were negative. Low level of complement 3 and complement 4 were detected. Viral serology for Epstein-Barr virus, cytomegalovirus, HIV, HBV, HCV, all were negative. The examination of bone marrow aspiration was normal. Nail fold capillaroscopy showed giant capillaries and hemorrhages in all fingers. Echocardiography and eye examination were normal. The abdominal ultrasound demonstrated a solid large mass placed in the inferior of the right kidney and lateral side of the inferior vena cava. It was characterized by dense vascular coding and renal duplex ultrasound imaging. Abdominal computed CT imaging displayed the characteristics of the mass near the right kidney and lateral side of vena cava inferior, with a solid and irregular shape. At post-contrast scan, it shows the feature of homogeneous central enhancement. Homogeneous contrast enhancement. Management: the patient underwent a total excision operation for the mass. The histopathological specimens were consistent with the CD in sinusoidal and vascular structure. CD8 was positive, and in vascular structure CD34 was positive. After surgery, she recovered well. Prednisolone 1 mg per kilogram per day and hydroxychloroquine 5 mg per kilogram per day were started. Her clinical complaint regressed in 1 month. Thereafter, prednisolone therapy was tapered. In the 3 months, she was in remission both clinically and in laboratory means, while receiving prednisolone 7.5 mg per day and hydroxychloroquine 5 mg per kilogram per day, and the abdominal ultrasound after surgery returned normal. So what is the diagnosis? And as usual we will leave you for 6 days and the answer will be online on next Thursday. والسلام عليكم ورحمة الله وبركاته.